Immunization is generally considered one of the most impactful and cost-effective public health interventions available globally, which helps to avert over 4 million deaths every year, especially among children. Reports have, however, shown that despite the huge role routine immunization plays in reducing the burden of diseases on individuals, families, and communities, about 2.3 million children in Nigeria are yet to be vaccinated. In a bid to address this anomaly, the United Nations Children's Fund, UNICEF, in collaboration with the Lagos State Primary Healthcare Board, organized a 2-day media dialogue on achieving the Health Sustainable Development Goals for over 2 million children at risk of death in Nigeria. The media dialogue, also meant to enhance routine immunization and to reduce zero-dose children, brought together journalists from the southwest states of Lagos, Ogun, Oyo, Ondo, Osun, Ekiti, and Edo, who gathered in Lagos to help raise awareness about the importance of embracing routine immunization, most especially among children. In her keynote address, Chief UNICEF Field Office for the Southwest, Céline Lafourcade, expressed the determination of the body to support the Nigerian's healthcare system and ensure that no child is left unvaccinated, just as she added that immunization remains an essential right of every child in preventing life-threatening diseases. She noted that UNICEF, in collaboration with the government, had prioritized 100 local government areas across 18 states of the Federation with a view to increase immunization intake, reduce the number of zero-dose children, and ensure that no child in Nigeria suffers from preventable diseases.
We want to ensure that by each year we increase the rate of vaccinated children by 15%. We need to have reached 30% more vaccinated children by 2025. This cannot be done without you, and we count on you to join hands with us today and make sure that we can leverage your influence. Your influence is very important. You can catalyze actions and you can share successes with us. By working collectively, we can build a resilient health system that is capable of reaching each and every child, leaving no one behind, no matter where they live, to ensure that no child in Nigeria is suffering from preventable diseases.
While speaking in an interview with journalists, Dr. Matthew Akinpelu of the Lagos State Primary Healthcare Board said the target of the Lagos State government and the forthcoming Supplementary Immunization Activities campaign, which kickstarts on the 19th of October, is to ensure that every child is vaccinated. He commended UNICEF for the fruitful relationship and assured the people of more commitment on the part of the government to protect children and pregnant women as well as the public from preventable diseases.
Once you can get that target, it means that there's a ripple effect. There's going to be lesser burden on the healthcare system. There's going to be lesser burden financially on the parents. It also means that as a parent, you have more economic time, because the time you're going to spend taking care of a sick child, you're going to use it pursuing better economic purposes.
In his presentation entitled Overview of the Childhood Immunization Landscape, MICS 2022 Results, focus on hard-to-reach population challenges, initiative, and way forward, the Assistant Immunization Program Coordinator, Lagos State Primary Healthcare Board, Dr. Adeniji Adebayo, explained that zero-dose children are those who have never received any form of vaccine since birth, warning that they pose a great risk to the health of others and can easily spread diseases to others, just like under-immunized children. He further explained that the Supplementary Immunization Activities campaign will be targeted at some specific antigens such as yellow fever vaccine from age 9 to 44 years, measles vaccines to children from age 9 to 59 months, and the HPV vaccine against cervical cancer targeted at girls between the ages of 9 to 14 years. Dr. Adebayo encouraged all stakeholders, including parents, guardians, religious leaders, traditional rulers, market men and women, as well as the generality of the public, to take advantage of the program and get vaccinated, adding that an unhealthy population would never be productive. Similarly, in her presentation titled Leaving No Child Behind, the role of UNICEF in strengthening childhood immunization, UNICEF's social behavior change communication specialist, Aderonke Akinola Akinwole, highlighted some of the roles UNICEF has continued to play in order to strengthen childhood immunization, to include ensuring the procurement of high-quality vaccines, provision of storage facilities and security to maintain the potency of vaccines, provision of seamless logistics of vaccines to locations where they are needed, among others. just as she added that UNICEF remains the leading agency and major donor when it comes to routine immunization, community engagement, and healthcare delivery. She called for more commitment on the part of the government through increase in budgetary funding for immunization programs, as well as on the part of other stakeholders to strengthen routine immunization among children, adding that disease prevention is the key to achieving sustainable health care delivery.
UNICEF uses social and behavior change strategies, which includes the use of communication and non-communication strategies and approaches to be able to build vaccine trust and demand. Social norms and social and cultural norms have been seen as one reason why people do not accept vaccine or do not trust vaccines. So what is being done is that UNICEF supports and empowers communities themselves to be able to come up with innovative, community-led and centered strategies to be able to debunk rumors. Rumors start in the community, spreads in the community, and it's going to end in the community. It has to end by the people who also spread that rumors, and that's what UNICEF does.
The media dialogue also featured a field trip to Badore Primary Health Care Center in Etiosa local government area of Lagos State, where the media team witnessed the immunization process. Oluchi Amda for Deadline.